Welcome to Suhail's Paramedical and Nursing Academy. So in the previous lecture I was explaining about the pharmacology. The lecture I have taken in the pharmacology was all about the anti-cancer drugs. Was all about the anti-cancer drugs. In the previous lecture I have explained anti-cancer drugs, the classification of anti-cancer drugs, then the mechanism of anti-cancer drug. Then after the mechanism I told about the toxicity or adverse effects of anti-cancer drugs. So today what I'm going to explain is anti-asthmatic drugs. So before I'm going to explain the today's topic, anti-asthmatic drugs, the drugs which are used for asthma. So before going to my topic, I want to say many people was having the confusion why I started this channel. So here I want to take 2 minutes, just I want to explain why I have started this channel. The main purpose of starting this channel is that our Prophet Muhammad, peace and blessings upon him, told that there are only three deeds which are remaining after the death of the person. When the person dies, only three deeds are there which are still beneficial for that person. Among these three deeds, one deed is that is called as beneficial knowledge. If someone is sharing knowledge that is beneficial to any other person, this is an sadaqah. Sadaqah means this will give benefit to the person who died. So that is the main purpose of this channel, because I am also learner, I am teacher here I am teacher also, but I am not only the teacher, I am the learner also, I am student also. So the thing is, if the person is getting knowledge here, my aim is to share the knowledge others, give others benefit, so that others will also make this topic easy. No one should think that these topics are very difficult. So that's why I have taken this pharmacology. Okay, leave this topic aside, why I have taken this channel. I already told you the main aim of this. So here the thing is, I am going to take anti asthmatic drugs. Remember one more in my lecture. So today's topic I want to tell is anti asthmatic drugs. So the drugs which we are given to the asthma patient are called anti-asthmatic drugs. So what do we have to remember in the anti-asthmatic drugs? What do we have to remember? First of all, we should know what is asthma. First of all, we should know what is asthma. What is asthma? So asthma is a chronic disease. Asthma is a chronic disease. What happens in the asthma? What happens in the asthma? There is a bronchospasm. Remember, there is an bronchospasm. There is an bronchospasm. What is bronchospasm? Bronchospasm means the bronchi and bronchioles. The bronchi and bronchioles will undergo spasm. The spasm means contraction. The spasm means contraction of the bronchioles and bronchi. The contraction of bronchi and bronchiole is called as bronchospasm. This is the first thing. And in addition, because this is a chronic stage, in chronic stage, when there is bronchospasm, there is also another thing that is called as inflammation. In asthma, that is, I am not taking the topic here, just I want to give the clue. So this is just a review. See, this is inflammation will be also there. There will be also the inflammation. So in addition to the bronchospasm, there will be inflammation also. There will be inflammation also. So this bronchospasm and inflammation leads to what? It leads to circulatory obstruction. It leads to broncho obstruction. Broncho obstruction. So the broncho obstruction means the the diameter of the bronchi and bronchioles will decrease. The diameter, the inside where the exchange of air will be reduced. The exchange of air between the lungs and the blood will be reduced. Why it will be reduced? Because there is bronchospasm. There is bronchospasm, there is decrease in the diameter. So here I will explain. See here. Suppose this is a normal bronchi. This is a normal bronchi, and bronchi will distribute into primary, secondary bronchi. Then secondary bronchi they will terminate into primary bronchioles, secondary, tertiary bronchioles. So I will show here one bronchi. So this is a diameter of one bronchi. See here, this was the diameter of one bronchi. It was this much. Okay. So this is the diameter of bronchi, normal diameter. This is the normal diameter of the bronchi. This is the normal diameter of bronchi. What happens? Air is coming. How the air is entering? air will come this way. Okay, so this was the normal diameter. So what happens in the asthma? A big asthma, suppose most of the cause in asthma is allergy. Any allergen, extrinsic or intrinsic. There are two types of asthma: intrinsic asthma, extrinsic asthma. That is not the topic here, but I want to say when allergen will enter, bronchospasm may occur there. So what will happen? This was the normal diameter. But what will happen in case of bronchospasm? In case of bronchospasm, this was what will happen. It should be this much. At least this much distance should be inside. This much diameter should be open. This much diameter should be open so that air will easily pass through the bronchi and bronchiole. But what happens is due to there will be bronchospasm. So bronchospasm means like this. See how much diameter is now reduced. This is the bronchospasm. As well as there is inflammation. So when there is inflammation, there will be production of mucus. There will be production of mucus. There will be production of mucus also. When there is production of mucus also, what will happen? That the diameter, the space will be decreased. The diameter for the gaseous exchange, for the gaseous transport will be decreased. So this was all about asthma. What is asthma? So you remember 2 pointers. One is what is called as what? One is called as bronchospasm, another is called as inflammation. So we are going to treat the asthma. We are going to treat asthma by 2 ways. We will give those medications which will treat bronchospasm. We will give those medications which will treat inflammation. So remember the point. 1 second. Just video is going on. Sometimes video may stop and I will be talking. Oh, so this is one will be bronchospasm and there is inflammation. Now we will give the medications to control these two types of bronchospasm and inflammation in case of asthma patient. Remember, see here, and I will make the classification very easy. See, I will make the classification very easy. Remember the trick, bro. Remember the trick here. BRO means bro. SAM is Sam. The Sam, calm. So suppose I have a brother. I told him calm. I told my brother, the name of my brother is Sam. I told my brother Sam, please calm. So that means bro, Sam, calm. This is the trick. Now I will tell how to put the drug. So there will be first trick. I am telling about this is classification. So classification I am telling the mnemonic. Classification of anti-asthmatic drugs. So see here, this is the bro. Bro means there will be broncho. First classification of drug will be bronchodilators. First classification of drugs will be bronchodilators. In bronchodilators, there will be further sub-classification. There are 3 classifications, sub-classifications of bronchodilators. One will be A part. First will be S. S means beta 2 sympathomimetics. Beta 2 sympathomimetics. Beta 2 sympathomimetics comes under bronchodilators. One classification. Another classification will be what? A means, we will first tell here. M means methylxanthines. So another classification is methylxanthines. This is the sub-classification of bronchodilators. One is called beta 2 sympathomimetics. Another is called methylxanthines. Another is A. A means what? A means C part, anticholinergics. So A means anticholinergic. Now it is your work to remember the drugs in these classifications. In beta 2 sympathomimetics, what you will remember? In case of C, this is methylxanthines. Remember, in case of methylxanthines, there is one drug that is called theophylline. Another drug that is called aminophylline. This is another drug. So one drug is called as theophylline, another drug is called aminophylline. Remember these 2 drugs in the methylxanthines. There are beta 2 sympathetics also. There are anticholinergic. In anticholinergic, remember I will first tell anticholinergic. One will be called as ipratropium. Ipratropium bromide. And another drug will be ipratropium bromide. There are, remember, two drugs in anticholinergics. You have to remember two drugs. One is called ipratropium bromide. Another will be tiotropium tiotropium bromide. So this was the classification of anticholinergics. Includes two drugs. One is ipratropium bromide, another is called tiotropium bromide. And now there is sympathomimetic. Sympathomimetic has further classification. One is called as short-acting sympatho beta adrenergic. We can say beta adrenergic. And there is long-acting beta adrenergic. I will explain this in the mechanism. So beta 2 sympathomimetic. Beta 2 sympathomimetic has two sub-classification further. One is short-acting beta 2 adrenergic. We can say short-acting beta 2 adrenergics, long-acting beta 2 adrenergics. So how we will remember the short-acting and long-acting beta 2 adrenergics? Okay, 1 second. While I just I will tell here. Okay, I will tell here. See here, short acting. In case of short acting, you have to remember two drugs. Remember two drugs in short acting: salbutamol and epinephrine. So these are the two drugs that comes in the short acting beta 2 beta adrenergics, and the long acting beta. Remember two drugs. One is what? SEST. Another is salbutamol, terbutaline. Remember terbutaline here. Terbutaline. Okay. So terbutaline drug comes in the long acting beta 2 adrenergics. Okay. So SEST. Okay. Oh, and here one more drug, that is salmeterol. Here was salbutamol. Here is salmeterol. So salbutamol, epinephrine, they comes under the short acting beta 2 adrenergics, and there is long acting beta 2 adrenergics. There are two classifications, terbutaline and salmeterol. So this is the work that you have to do. Okay, this work is your work. You have to remember these drugs in this class. These are called as bronchodilators. This is the first classification. After this classification, I am going to say you can take the screenshot of this. Part. I will go towards the next part, next drug class. This was bronchodilators. So this was the first classification of bronchodilator. So bronchodilators I have further classified, and I have told the examples that comes under the bronchodilators. So the second is see here. The second classification is CALM. The second will be corticosteroids. So corticosteroids, you can also say them. These are anti-inflammatory agents. Anti-inflammatory drugs. Or you can say corticosteroids. These I have told here. See. So what will be the drugs that comes under corticosteroids or anti-inflammatory drugs? Remember, one is called as prednisolone. You can remember. Okay. The main drug here is prednisolone, that comes under the corticosteroids or anti-inflammatory drugs. There are many drugs you can remember. Another classification is A. Suppose this is C is corticosteroids. A. Now second we will tell about, this was the corticosteroids. Now we will tell about anti. This was C for corticosteroids. They are also called as anti-inflammatory agents. The drugs comes, that is prednisolone. Okay, that is prednisolone. Now I told about A. A will be, there are A for two types. Remember A for two. One is called as, this is, suppose we will tell first this leukotrienes. The leukotrienes, remember the leukotrienes consists of, there are two drugs which comes in the leukotrienes. One is called as zeferleucost. another is montelukast. So zephyrleucost, montelukast, these are the two drugs that comes under leukotrienes. I told in corticosteroids there is prednisolone, and I will one more classification is there is mast cell stabilizer. Mast cell stabilizer. Another classification is mast cell stabilizer. In mast cell stabilizer, what we have to remember in the mast cell stabilizer? 1 second. You remember this sodium, one drug is that is called sodium chromoglycolate. So sodium chromoglycolate comes under the mast cell stabilizers. Remember this one drug is enough for this. One more classification is there, that is anti-Ig antibody, because there is A means anti-IgE anti-IgE antibodies. So anti-IgE antibodies, that means see in anti-IgE antibody what you will remember there is no drug, don't remember the drug in the anti, just remember there is anti-IgE antibodies. So this was the classification. Today I will tell the classification. In next lecture I will tell the mechanism and adverse reactions after the classification. So today remember, one was bronchodilators. In bronchodilators I told you there are three classifications. One is sympathomimetic, beta 2 sympathomimetic, another is anticholinergics, another are methylxanthines. I told already what are the drugs that comes under these three. Then I told this was the bronchodilators, this is the subclassification for it. Then there is CALM. C means there are corticosteroids that we are giving, these are anti-inflammatory agents. One example is prednisolone. Then I told there is leukotrienes. There are two, zephyrleucost and montelukast under the leukotrienes. No, it is not leukotrienes, it is anti-leukotrienes. 1 second, why is this duster? Why I forgot. This is I will write here. This is actually leukotriene. This is actually leukotriene receptor antagonist. So this is leukotriene receptor antagonist. The example is zephyrleucost, montelukast. There is mast cell stabilizers. Example is sodium chromoglycolate. Then there is anti-IgE antibodies. This is the classification. So here I want to tell about. So the first tomorrow I am going to tell about the mechanism. Before going to the mechanism, I will tell some basic also about this. So